Why advanced care planning is important to me. As a nurse for the past 17 years, I've witnessed suffering when patients are in emergency situations without advanced care planning. I've seen CPR and futile care provided, resulting in an uncomfortable and unpeaceful death. Other situations associated with the lack of advanced care planning include patients and families who were forced to make tough decisions during an emergency without the ability to process, understand, or comprehend their decisions. I would like to share a story about our Uncle Sal. This is a picture of me, my husband, and Uncle Sal at our wedding. Uncle Sal was 75 and in incredibly good health. He was retired and enjoying life with his wife, working with his daughter at her family-owned business, and walking about 3 miles each day. Last October, unfortunately, Uncle Sal was infected with COVID. He remained reluctant to ask for help and seek medical care. By the time he went to the hospital, he was very sick and had blood clots in both lungs. He was admitted to the ICU, but over the next day he began to improve. He was moved to the step-down unit and we all felt relieved. That morning he ate breakfast, was able to get out of bed. But during the afternoon, things took a turn for the worse and he began having severe difficulty breathing. At this time, care providers offered him the option to go on a ventilator. Knowing little about the ventilator and assuming that this would mean he would be on life support for the rest of his life, he made the decision to sign a DNR. He rapidly deteriorated and passed away in less than an hour. The tragedy of this situation is that advanced care planning discussions could have potentially saved his life. I often imagine if primary care providers were proactive and discussed advanced care planning during our annual exams, things may have been different for Uncle Sal and many other patients. If only Uncle Sal had known that the ventilator would have been a temporary solution, he would have had a chance to survive and be with his family who loved him so much.